I'm Dr. Buford. I'm here with Dr. Moore. We're just getting started on your left shoulder. We're looking at from the back to the front. Everything that you see is magnified about 40 times on the screen. Here's the tear in the biceps, so we are going to put a stitch in that just to secure it later. While we're getting the spinal needle and the relay ready to go, we'll probe it and show you why this is an issue. You can see the torn edge here, and we can see how this displaces. This is the biceps tendon running up here. Now you've got something on the back side here. A little bit of a fraying of the undersurface of the, really the most anterior edge of the supraspinatus. But that whole area is just 2 millimeters, super small. So we'll debride that, and it should be of no significance, no consequence. Now the rotator cuff on this side looks pretty good as we look up here. Okay? We're going to come around to the back. Here's the posterior glenoid, posterior joint capsule. That all looks good. There's a little bit of thinning on the humeral head, thinning of the cartilage, but no significant lesions. And then as you come back around and look down the front of the shoulder, the anterior labrum here looks fine. The anterior band of the inferior glenohumeral ligament is going to be, that's going to be this band right here. That's the anterior band of the IGL, or inferior glenohumeral ligament. That was fine. The middle glenohumeral ligament crosses the subscap, so this is the middle glenohumeral ligament right here. And then you've got a little tear in the leading edge of the subscap too. We call that a Fussi lesion, F-U-S-S-I. And these can usually just be debrided, don't need to be repaired. Go ahead and internally extend and rotate. Yeah, so okay, so that actually may be a little bit more than normal. I'm just trying to see how deep that goes. Okay, pause. Okay, so now we're just, first of all, we're going to focus if we can. And we're just going to clear off some space on the insertion of this subscap tendon here where it's torn. We haven't done anything to the tendon, so that's just tearing that you had. And we're going to plan on placing an anchor into the bone basically right about here. Okay, so here are the 3 sutures from the anchor that we just put into the bone here. And now we're going to do some tricks to pass these. We'll show you some more in just a minute. Now we're going to go ahead and start passing our sutures. We'll probably just use 2 of these. I'm just trying to decide which one I want first. That way, we'll take the black and white striped suture first. So that's going to come out right here. Okay? Pull tight on these others. And so the next step will be to pass a pass a stitch through the torn edge of the subscap. And the other sutures outside the cannula, so we won't have any problems with our sutures getting crossed or tangled. We'll take our crescent suture, go through that clear cannula on the left. Here it is right here. It's loaded with a black wire called the super shuttle. There it is there. We'll pull back here. Now with this first one, yeah, your left hand. Right about there. We'll feed that through. We'll show you some more in a minute. Okay, so now we're going to pull back on the suture. You can see how that now goes through. out over here. So a little bit of a, come straight up, please. That suture is coming right through the edge of the subscap there. So now we're going to get the partner black and white suture, and then we'll pass another stitch. Okay, we're just getting ready to tie down these two sutures. Looks like that one's the one coming through the tendon, which is what we want. Okay, so looks like a pretty tight knot there. We'll go ahead and pass point by doing that. And then we'll finish this knot and show you some more in a minute. Okay, so we've tied both stitches, and now that looks pretty good. You can go back on the video and look at where we started, but now this subscap is running up in the right direction. And I think we've got it anchored down to this insertion right up here where the probe is going. That's where the anchor is. And so we're going to stop there. I'm going to come back around and we're going to look at the biceps now, because we've still got that biceps issue to deal with. And the way that we're going to deal with that is we're going to take a spinal needle and pass it through the tendon in just a minute. Okay, so we're going to go ahead and there's our needle coming through the tendon. We're using that same shuttle. We'll back the needle out. And then here we'll go ahead and load this with a free stitch. There's no anchor attached to this one. So pull back, you can see how that goes through. And now we're going to take that spinal needle and do it one more time. Essentially in the middle. It's not a bad spot there. We'll feed that relay through again and show you some more in a minute. Okay, so we've cut the biceps tendon here. There's the cut edge. And now the reason this will work is because now it won't tug on the labrum anymore here, and the labrum will get a chance to recover and heal. We're going to put in a shaver just to make sure there's no more rough edges in here. Nothing that can catch or cause any symptoms. So where we are right here, this is the superior labrum. And you can see the biceps used to be basically right there. We've taken off a little bit of bone from the acromion, and what we're actually showing you here is our decompression of the AC joint. This is the clavicle on the left. The acromion's actually on the right, back over here. Let me get back into the picture here. And so now we've got plenty of space between the acromion and the clavicle, at least 6 millimeters, probably actually closer to 7 or 8. Taking a little bit more bone off the acromion in the back right here. Okay, so that looks good. So we're going to finish up here and get you back to the recovery room. But actually, before we do that, we've got to tie one more suture. Hold it, Karen, please. We've got to tie the sutures for the biceps tendon. So we'll pull back with our scope. And the left, so we're going to crochet hook so we can retrieve them and show you some more in a minute. Okay, we're just finishing tying the suture here. And again, this is to secure the biceps tendon. We'll go ahead and cut these suture tails. And then we will go ahead and have a look at the dorsal side of the rotator cuff just to make sure there's no hidden tearing on this side. Sometimes you see these dorsal-sided tears. So external rotate. So here's the anterior portion of the cuff as she abducts and external rotates. That looks fine. We'll come back here a little bit. Yep, go ahead. Yep, which way are you going? With your external? So go ahead and go external now. So now this is the anterior portion of the cuff with external rotation. That looks good. Let's go ahead and come back in internal. And all along the rotator cuff here, this all looks solid. So we're going to finish up here and get you back to the recovery room in just a few minutes. Good luck to you now. Bye-bye.